Good morning, your health nation. It's Ashley. It's Thursday. It's time for our weekly live training session. But first of all, hopefully you guys are doing awesome. And we're closing in on the end of the week. I know for me it was a little bit of an odd week because of Martin Luther King's holiday. My stepkids, they were off from school, so they were home. We had snow here down in Atlanta, which is abnormal. So everybody was freaking out about that. And then they were predicting more snow for this weekend, but so far they've said no. So I'm a little bit relieved over that because obviously for here we don't handle the snow as well as those who are in northern states. So yes, I'm glad we're not going to be having snow this weekend, at least as of what they're predicting for right now. Hopefully you guys are all staying safe with all the winter weather going on out there. But otherwise, let's jump on in. Today we're going to be talking about neck pain. And I know this is a common complaint for a lot of people. I know I have neck pain, thankfully not frequently, but frequent enough that I know what it feels like. And part of the whole reason why is the structure of your neck. And that your neck is designed to be flexible, but it also needs to support the weight of your head, right? And so this though means that it's vulnerable to injuries and conditions that can cause pain and restrict movement. So there's many different causes that are common. Obviously, there can be rare cases of rare diseases, but we're not going to really get into those. We're going to just talk about the common stuff. So, biggest one is muscle strain, and that's usually from overuse. A lot of that, especially given the way we live nowadays, is the whole idea of, what we do for work, what we do in our downtime. So we spend a lot of time hunched at a computer or looking at a smartphone or something of that nature, which triggers our neck muscles to be strained and tight. And I mean, even minor things can cause neck pain. If you're reading and you've got your head at an odd angle, I know growing up because we didn't really have smartphones. I mean, they did. I just didn't have one. Um, so I'd constantly read in bed, and of course you're all tucked in, trying to hide so that way you can read at night, and often would have neck pain from that. If you grit your teeth, it strains all the neck muscles in here, and so that can actually lead to neck strain as well. So there's just so many different things that can cause neck strain. And that's usually the most common cause is there's some form of muscular strain that causes discomfort that results in the pain. Other big issues is worn joints. Just like any other joint in your body, your joints in your neck and your spine can actually get worn over time. And this normally occurs with aging, such as with osteoarthritis, and that causes the cushion or the cartilage in between your bones or the vertebrae in your neck to deteriorate over time. And this can also, obviously, when that happens, then your spinal bones, the vertebrae, actually start rubbing on each other. And that's what can cause a lot of discomfort. And then another big thing is that over time, bone spurs can form. And a lot of people think of bone spurs happening, you know, in their foot or somewhere else in their body. They don't really think about it happening on their spine, and it can. And that really can affect the joint's ability to move and cause in pain. So this is why it's so important to be aware of this, because then there's certain steps that we're going to talk about in a little bit that you can hopefully help prevent some of this from occurring. Another big issue is nerve compression. And this occurs thanks to the bone spurs, because if the bone spurs actually put pressure on the nerve, it can compress the nerve. And that results in a lot of different issues that can happen, such as obviously not just pain, but you can have numbness and tingling and such because it's pressing on the nerves that are coming out from your spinal cord. Another thing that can cause nerve compression are herniated discs. And what happens here is that the discs, which are the little cartilage in between your vertebrae, get compressed, that they actually bulge out of the spinal canal where they normally sit in the little circle, and that can put pressure onto the nerves of the spinal canal. And that can result with the similar symptoms as a bone spur putting pressure on that. Another one that's a big one if you've had any form of injury, and this can be a great example of this is rear end auto collisions. It's when you get hit from behind. It gets that whole whiplash thing of your head going back and then forward. And what that does is it causes the soft tissues of your neck, the muscles, all of that, tendons, ligaments, to become strained. And that can result in a significant amount of pain. And obviously, that's just one type. There's many different ways to injure your neck, but usually it's all related to soft tissue injuries in most cases. Obviously, if you have anything where you have a significant fall, I mean, you can have fractures in your spine and all that, and the complications from those are usually quite serious. And that's a little bit above and beyond the type of neck pain we're talking about today. Some other causes can be certain diseases can result in neck pain, such as rheumatoid arthritis. It's similar to osteoarthritis, but usually it is more genetically related. It's not related to aging. So this can usually show up in younger individuals. Meningitis, obviously, that's an infection of the tissues that line your brain and can also cause inflammation and such within the spinal canal. So you can often have neck pain as a result of that. And obviously, cancer, because cancer can show up pretty much anywhere in your body. So you can have neck pain as a result of that if you have cancer within your neck area. So, at this point, I mean, those are the general broad causes of neck pain. As I said before, the most common ones are usually due to some form of muscle strain. That's what the majority of us experience when we're having neck pain. It's not usually related to the others because it usually comes on fairly quickly. I mean, you can sleep wrong and wake up with muscle strain. And usually for me, this is the one that causes the most discomfort. And I'll know when I wake up in the morning if I have this little twinge that I'm like, oh no, here it comes. And unfortunately, it just causes this whole muscle spasm and it'll last several days. Versus some of the others like the worn joints, the nerve compression, all of those usually come from long term. So you're going to notice gradual increases in symptoms rather than all of a sudden it just comes on like that. So besides pain, you can have obviously muscle tightness and spasm. You can have decreased ability to move your head from one side to the other, up or down, whichever direction. And I know for me that's a big one when I get my neck pain. And then you can have a headache because obviously there's muscles that come from your neck over the top of your head and actually sit right here. And so sometimes for me, if my neck is tight, I will have this throbbing headache. And I know others, individuals have described that as well. So that is an indication, if you get your neck pain resolved, to make it feel better, typically the headache goes away as well. As far as when you should see a doctor, most of the time when we're talking about muscle strain type of neck pain, that can be treated at home. And we'll discuss some of those tips for dealing with that here in just a moment. But if you're doing home treatment and it's not getting any better, then you should be seeing a doctor. And usually it's not getting any better within several days. Because obviously with any sort of muscle strain, not just in your neck, it takes a few days to get those muscles to loosen back up. And that's, we'll go into how to do that here in a second. But if you're not getting any better after doing home treatment, that's when you need to go see your doctor and see what else might be going on. You should seek immediate care, though, if your neck pain results from any form of an injury, such as obviously car accidents, if you are diving, like swimming, and you're diving into the pool and you have some sort of accident, because obviously you can get significant head injury from that, is in addition to causing neck injury, or if you have any sort of fall. Any of those would be an indication that you need to seek emergency care because if there's an injury involved, not only could you obviously have muscle strain and pain, but you could have obviously damage to your spinal cord, and that would be huge to make sure it gets addressed sooner rather than later. And you should also contact your doctor if your neck pain is severe. As I said, persist for several days without relief after trying anything, or if it spreads down your arms or legs, that's usually an indication there's something a little bit more going on than muscle strain. Or you have where it's not just accompanied by a headache, but you are having numbness or tingling anywhere in your body, weakness, or anything like that, where it's much more involved than just your neck. You're having more generalized symptoms. That's an indication that something else is going on and that you really need to get it checked out. So typically if you have to go to the doctor, as far as diagnosis, there's several different tests that your doctor can do. First, they're going to talk to you about your medical history, ask you, hey, what's going on, how to start, all that stuff. Then they're going to go and do actual physical exams, see what's going on, try to have you move your head and all that stuff to see if there's any specific areas that are tender, anything that's numb, if any weakness, anything, as they're moving your neck, you have a increase in symptoms or decrease in symptoms. That's going to give them an idea of, okay, well, maybe it's this, maybe it's that. If they need to, they can order certain imaging type of tests. X-rays can reveal like where your nerves or spinal cord might be pinched, just because they'll show up like bone spurs or any other degenerative changes that are related to your bones. X-rays are great at showing up bones, but they don't really show up soft tissue that well. So if there's anything related to your skeletal system that's not right, they will show up on X-ray. Typically, X-rays are the first type of imaging that doctors recommend because it's usually the least invasive, and typically with skeletal issues, that's the best one to be able to find it. If there's nothing really conclusive on the X-ray, then your doctor might have you go for a CAT scan or CT scan, and this does allow the doctor to take a more look at those soft tissues, that internal tissues of your neck, to see if there's something else going on there. Another one is that gives really great detail is an MRI. Typically, this is after you go through X-rays, after you get your CT scan, and there's still really nothing that the doctor can find, then they'll probably recommend an MRI because it's a little bit more not only time consuming, but obviously a lot of people, because of the MRI machine, are claustrophobic because it's really close. And so that way, if you don't have to have that, the doctors try to diagnose it without going that route, but if they need to, they will recommend that. So it's really important to obviously go to your doctor, get tests, imaging tests. There are other tests that can be done, such as the electromyography or EMG. And this is usually recommended if the doctor thinks that you have a pinched nerve. And what it does, it involves inserting fine needles, into your skins, into the muscles, and then performing like tests to measure the speed of nerve conduction. And if a nerve is pinched, it's not going to conduct the signal as quickly and efficiently as it would if it's not pinched. So that's what they're looking for, is that difference. You can also have blood tests done, and this here will be showing if you have any evidence of inflammation, any infectious diseases such as meningitis, rheumatoid arthritis. That's how they're going to be able to help determine if you have those, and that's what's sort of causing your neck pain. Obviously, that's much more involved, much more in depth than what most people need when they're having neck pain, but they just wanted to give you a little bit of a background as far as, if you're having neck pain and it's been ongoing and it's not going away, this is what you could expect your doctor to recommend that you would need to have done to try to determine what's causing it, so that way you can obviously get some relief. So, usually, the most common types of mild to moderate neck pain are those of muscle strain, and they respond fairly well to self-care at home. It takes about 2 to 3 weeks sometimes, depending on the severity of your symptoms, to get full relief. And that's where, if each person's individualized as far as how quickly their pain gets relieved. I know for me, if I wake up with neck pain, it takes a good 3 to 4 days to finally feel like I'm mostly normal. And during that time, it's incredibly painful. Usually I can't turn my head to whatever the side's, affected. It hurts, coming over my head. But thankfully, it doesn't last 2 or 3 weeks. But there are some measures that I take the minute I start feeling it. And these are the same things that I'm going to talk about with you as far as recommending you try at home. Big thing, obviously, over-the-counter pain relievers are key here. If you can take anti-inflammatories such as ibuprofen, which is Advil or Motrin, or naproxen, which is Aleve, those are great. Obviously, certain individuals, those who have like kidney disease or other things like that, should not be taking those, so you want to check with your doctor before you take that. But those are great for a couple reasons. Not only do they provide pain relief, they're also going to help reduce any inflammation. And that can be key, because obviously when things are strained, it causes them to become inflamed. And then when you have inflammation, you get more pressure in the area because of the inflammation, which only contributes to the pain. And it's just this cycle that continues. So by taking anti-inflammatories, that usually helps with both of those. If you can't take NSAIDs or non-steroidal anti-inflammatories like ibuprofen or naproxen, you can take acetaminophen, which is Tylenol, or something else that's similar. The big thing is obviously, depending on your medical history, it'll depend on which type you should be taking as far as over-the-counter medicines. The next big thing here, and this is so key, is alternating between heat and cold. And it might sound counterintuitive to do this, but it's really important. You can reduce inflammation by applying cold. And this is where ice pack, ice wrapped in a towel, something that you can wrap around your neck for at least 20 minutes at a time, several times a day. This is going to help get that inflammation down, which is very important because obviously that's part of what's causing all the discomfort. And you, for some people, though, myself included, I mean, I will do the cold therapy. It's not my favorite because I don't like being cold, but you can alternate it with heat. And the nice thing about when you alternate is when you put stuff on there that's cold, it's reducing inflammation. And then when you switch over to the heat, what that does is it increases blood flow to the area, which helps absorb that extra fluid and stuff that's causing the inflammation. So it sort of helps pull it out of the area. And for this, if you're trying to do heat, you can do like heating pads, a hot shower. That's really helpful. And so to me, I prefer the hot stuff, but I will alternate back and forth because I know what's best, to get that down. But it really comes down to what works best for you. Which one do you find, is it cold therapy? Is it warm therapy? Is it a combination of the two? Which one is helping you feel better? There's no real right way or wrong way to treat this. Is just you have to figure out which is the best option. And then the other big thing here is gentle stretching exercises. And this is important to usually do not only when you have neck pain, but also important to do all the time because this is hopefully will help keep those muscles nice and loose and relaxed so you're not going to have neck pain to begin with. But if you do have neck pain, gentle stretching exercises is key. This is because obviously, it's going to hurt. It's like any muscle that's been used. And, when you think of if you've exercised and you have muscle soreness and you're trying to stretch, you're trying to just gently stretch those muscles, so that way they are not so tight. And that's the same concept here with your neck is, you might not have exercised your neck, in the traditional sense of exercising. It's more of the idea of you've somehow strained those muscles and you're trying to just get them to gently relax. So key thing here is just, make sure you're not trying to be too aggressive. If you're unsure, you can always ask your doctor. If you have neck pain frequently or it's severe, your doctor might recommend physical therapist to give you some proper techniques when it comes to stretching. And if they do, that's great. That is important to follow because obviously you want to feel better, but you don't want to cause permanent injury or damage, right? So the key thing here is before you do any stretching, you want to make sure you warm up the area with a heating pad, the shower, or bath, something, because that's going to help get the muscles loosened up. And the best way to think of this, same thing if after exercising, when your muscles are warm, they recommend doing, a cool down to help get the muscles so they don't contract as much. And then, and that's the big thing. And so obviously with neck strain, typically you're starting with cold muscles, right? They're not heated. So by getting them warmed up a little bit, they're going to be a little bit more receptive to being stretched. And so once your muscles are warmed up, then you can just sort of gently, try to tilt, try to stretch, go as far as you can and hold it. Make sure you're breathing. Don't hold your breath because, the breathing actually helps gently stretch the muscles. Nice, even breathing, not hurried breath or anything like that. If after all that, and you're trying it and it's not working, then you go to the doctor. They might prescribe stronger pain medicine. And they might also try a couple other different kinds of medicines, such as muscle relaxants and tricyclic antidepressants, which are actually found to be great for pain relief, in addition to being an antidepressant. Both of these categories, along with the prescription pain medicines, you all need to get a prescription from the doctor in order to get them. It's not something you can go buy at the pharmacy without it. So your doctor might give you something for those if you're really, having trouble with neck pain. And then, once again, as I mentioned before, they might mention going to a physical therapist. And physical therapy is great because not only are they going to give you stretching exercises to help in the here and now when you're feeling pain, but they're also going to help you find ways to correct your posture and alignment and give you strengthening exercises to do once you're feeling better. And so this is so important because it can help, prevent neck pain in the future if you're following what they recommend. In addition, most physical therapists are going to use some form of heat, ice, electrical stimulation, or some other type of measure to help get that pain down. And when it comes to electrical stimulation, they actually sell little mini units over the counter, and I actually own one. They're called TENS units, which stands for Transcutaneous Electrical Nerve Stimulation. And what this does is you put a little electrode, essentially, on your skin, connect the little device to it, and it sends tiny electrical impulses. And what that can do is, because it's sending impulses to the nerves, it can actually make it feel better. You're sort of overriding the communication from your body saying, hey, I'm in pain, and the nerve signals from that. And this is helping, override that. And therefore, sometimes by cueing the nerve signals to be a little bit different, it actually can help relax the muscles. And sometimes it's effective for me, sometimes it's not. So everybody's different. I mean, I'm different every time I use it as far as whether or not I respond well to it. I just think it depends on the severity of the muscle strain. But definitely give it a try. They're not overly expensive. The little electrode pads, you can usually reuse them a few times before you need to get new ones because they lose their stickiness. But otherwise, it's a great option to have on hand if you have neck pain or any sort of muscle pain because you can use it anywhere on your body. So definitely try that. Another concept, and usually this is done also at a physical therapist's office, is traction. And what this does is thought of as trying to stretch your neck. And this is usually done with weights, pulley, air bladder, something that's designed to help put a little bit extra weight as far as when they're trying to gently stretch. And this is why you want to make sure this is done under either physical therapist, doctor, someone who has been trained how to do this properly, because otherwise you can have significant injury. So definitely don't try this at home. Only do this, if your physical therapist or your doctor recommends it. And sometimes in severe cases, your doctor might recommend like short-term immobilization. So this can be like a soft neck collar that you have to wear. And by doing that, what it does is it provides support. So it's actually taking the strain off of your neck muscles because it's supporting your head. And that's part of, what's causing the strain is that when your head, it sits on top of your neck, which is supposed to be flexible and movable, but, your head is heavy for what's in your neck. There's not a lot of actual bone structure in there. It's just your spine, right? So compared to the rest of your body, where there's more bones to support the structure. So this is where by having a collar, it can be helpful because it's taking that pressure, that weight of your head off your actual neck muscles. So it really depends. Your doctor will recommend as far as how long you need to wear it. Sometimes it's 3 hours at a time for a week or two. But you just have to be careful because you don't want to wear it too much because then, other muscles can get stiff because you're not able to turn as well. So your doctor will really guide you on this if it's something that they feel that you need. But this is definitely not the go-to when you're trying to get treatment. I just wanted to give you an idea if it's something that's available if needed. Some other options is if you're having issues with your nerves, that you can get steroid injections around them because nerves can become inflamed, and when they do that, steroids help reduce inflammation. So these can actually be injected around the nerves that are coming out of your spinal canal. They don't actually go into the nerves. And when you're injecting around the nerves, it sort of like coats them in there, and this helps reduce that inflammation. It does take a little bit of time for that medicine to, work, usually a week or two. But if it works, it's really great. And in fact, this is one of the services that we do at the place that I currently work at, is we provide these type of injections to people who need it. And some people, they're like, this is amazing, Other people doesn't work as well. Everybody's different, it's just how your body responds to it. But for those that it's life changing. Um, and then sometimes if you're having obviously herniated disc, bone spurs, anything like that, you might need surgery to correct it. But your doctor will obviously tell you if that's something that you need. Um, as far as like alternative types of medicine go, a lot of people look at acupuncture as far as trying to find pain relief. And while sometimes this can be helpful, usually it takes several sessions, if you will, if you're going to be able to see results. So some people get results, some people don't. But definitely make sure that if you're going to go down the route of acupuncture, talk to your doctor first, and then find a certified practitioner that uses sterile needles. And those are the two key things right there if you're looking for an acupuncturist, because there is a certification process. Not just anyone should be doing it. And you want to make sure they have sterile needles, because obviously you don't want to get an infection anywhere in your body, which can happen if you don't use sterile needles. Some other options are obviously chiropractic care. And this here is when a certified chiropractor manipulates your body in ways using your own body force to help realign your spine. And sometimes if you're having compression, this can be great because it stretches everything out and you feel really good. Just keep in mind, obviously if you have certain medical conditions, you shouldn't be doing this. So definitely check with your doctor before you do that. Another great option is massage. And so, some people, similar to acupuncture, they're like, this is awesome. I get great relief. Other people, no. I know for me personally, I don't like it when other people massage my neck when it's sore. But I will actually sit and rub the muscles and such, and because I can feel where it's like all knotted up. And that's basically where the muscle spasm is. And so I will gently rub that after putting like heat on it. Because I find that I can get the right pressure, the right depth, everything compared to others. So definitely want to, other people they'll enjoy when, part of it's the whole relaxation. So really depends on what works for you as far as that goes. So that pretty much sums up the whole treatment concept. And obviously there was a wide range there from, the primary focus should be doing at home type of treatments. If you need to, because you're having more chronic neck pain, obviously there's a bunch of options there as well. But definitely if you're having neck pain and it comes on suddenly and it's most likely muscle strain, try the at-home stuff first. You'll probably feel a lot better. Just remember it's going to take a little time. Don't expect it to just, magically go away. I wish that was the case. That would be nice. But no, it doesn't. So when it comes to preventing neck pain, and this is a big one. This is something that I try to remember to do, all the time. And one of the biggest things there is good posture. And I know I'm currently not sitting right because I can just tell because my lower back is starting to hurt a little. But the key thing is making sure that your shoulders are in a straight line and actually over your hips, and your ears are over your shoulders. And you should be doing this whether you're sitting or standing. And I know right now I'm not sitting that way, so I'm not demonstrating this very well at the moment. But the whole idea is by doing that, it allows for the natural curvature of your spine. And when you have that, that is something that's so important because obviously that's going to keep your spine in good alignment, prevent bulging discs, and all this other stuff. Other big thing here is if you're working at a computer or you're traveling long distances, key thing is to get up and move around. And this is important for all parts of your body, but especially your shoulders and neck, because we just subconsciously, get in a position and stay there, and then we just don't realize exactly how uncomfortable it is until we go to move and we're like, ooh, that's stiff. So that's where taking frequent breaks should hopefully prevent that stiffness. Make sure you have your desk and computer and chair all at the right levels. And what this means is that your monitor should be at eye level, and that when you're sitting, your feet should be flat on the floor or on something, so that way your hips to your knees are at a 90-degree angle and your knees to your ankles are at a 90-degree angle. So it's sort of like that. If this was your hips, that's your knees, that's your feet. And what that does is it helps keep everything in proper alignment. And by sitting like that, you're not straining one way or another, you're not hunched over and all that good stuff. If you have to talk on the phone a lot, and this is something that with smartphones being available or any cell phone being available, we all do one of these, right? Prop the phone in here. That right there causes a significant amount of neck strain. So if you have to talk on the phone a lot, use headsets, use something, so that way you're not tilting your head to one side or the other to be able to keep the phone there. And what they're finding is if you smoke, it's important to quit. For some reason, smoking is associated with a whole host of problems, but it's also associated with higher risk of having neck pain. If you have, for women, or I guess men, if you have computer bags or anything that's heavy, don't try not to carry it on your shoulder, because especially if it's just on one side, because it's going to pull down that side and it's going to pull on that part of your neck. So try to empty out your bag so that way it's not as heavy. And then, if you can, backpacks are great because it actually distributes the weight evenly. And it's actually, if you put on a backpack appropriately, it's going to pull you back rather than hunching into the backpack. Sit like, have it pulled back like that. And then this is my big one. This is the big one for me. Sleeping in a good position. You want to have your head and neck aligned with your body. So for me, I'm a side sleeper. They have awesome pillows nowadays. They have a little cutout for your shoulder, and that has a little extra bump right here. So it actually keeps my neck perfectly straight. And I can tell if I'm not in the right spot, because I'll wake up and be sore. And if you are a back sleeper, try elevating your thighs, knee area on a pillow, because that's going to take the pressure off your lower spine and actually keep your spine in better alignment. So if worst possible way to sleep is stomach sleeping. Occasionally I do sleep this way, and I think that's usually what causes my neck pain. And when I wake up the next morning, I'll be like, I must have slept on my stomach. And it's just because of the way your head's turned when you're on your stomach, is that it's just not allowing for your neck to be properly aligned. You're straining muscles, all of that. And so this is, a big thing here is sleep position is a crucial one, along with good posture. Those are probably the two top preventative techniques I would recommend. Look at your workspace environment, because obviously that contributes to your posture significantly. Adjust stuff that you need to in order to get proper posture. But that's pretty much it for neck pain. I think we covered a lot of material today. So if you guys have questions, comments, send me a message, put them in the newsfeed in the group. I'd love to hear from you guys. So hopefully you found this helpful. If you guys have neck pain, hopefully this helps you a lot. But definitely, I will see you guys next week. I'm not quite sure yet when the training will be, but I will let you know. And if you have anything you want to talk about, send me a message, put it in the group feed, and I will see you next week, and have a great weekend. And until then, you guys stay healthy.